really pleased to offer the 3D TrichoLAB planning at Dr. Ted Hair Transplants. We're a clinic and Ted is a surgeon known for doing larger cases, so we always want to have an extra layer of diligence when it comes to extracting a lot of grafts out of donor areas. So we think planning is really important. So we're really happy to sort of take our planning to the next level for all of our patients and offer them that clarity about what they really need going forward. When we have a patient over for a consultation using the TrichoLAB software, we're essentially trying to show them what they have in their donor area and what's possible surgically. So we're taking all sorts of measurements, the size of their recipient canvas, the density of their donor area, the caliber of their hair. And essentially, we're trying to give them some clarity about what's possible and what's not possible, maybe, with respect to surgery. So many patients, when they're doing their consultations with multiple clinics, they'll get a range of numbers. They'll get graft estimates that can really quite vary, and what patients usually want is some clarity about how many grafts they really need, not just for now, but maybe in the future as well. If they're going to continue losing their hair. So I think clarity is the key thing we're trying to give patients, and also showing them what might happen if they don't take their medication and they maybe lose hair behind the transplant. So just clarity about how many grafts they need now, how many they might need in the future, and just a bit of a plan going forward.
My procedure was fairly straightforward. It was easy. It was no pain at all. It was interesting to see my scalp up close and whether I'd be like sort of a potential candidate for a transplant. But it was quite sort of therapeutic actually, having my hair brushed. So yeah, I'm not used to it, but it was easy. It wasn't time consuming at all, and it was a pleasure.
I think broadly speaking, it will help in two ways. One is to quantify what we do with intuition and intuitively and with experience. So, roughly how many grafts will achieve certain level of coverage, but you can demonstrate that to patients, which is really effective to help them understand what coverage 2,000 grafts would look like, so they can make better informed decisions about the number of grafts that they have. You can also use it to quantify what the donor area will look like. So we do quite big procedures here, and it's a way of helping us work out the donor availability so that we don't overharvest the donor and leave enough in the reserves for their future. I think the other way it will help, other than demonstrating that knowledge to the patient, it will actually quantify in quite difficult cases. Let's say someone's got diffuse thinning, you'll be able to use a combination of the trichoscopy with the 3D render to be able to have a much more definitive number of grafts, so that will enable us to be much more precise in terms of our operation planning. Well, both, in answer to your question. Talking to Ryan, our patient advisor, we're going to use this as a sort of tag team. So patients will have their initial half of their consultation gathering data using TrichoLAB, and then the second half of the consultation is using that data to have an informed discussion with patients. So it will certainly help where there is some uncertainty about how many graft numbers are exactly required, but often there are difficult discussions about whether someone should have a 3,000 graft procedure or a 5,000 graft procedure. Now you can demonstrate using the 3D render exactly, near enough, what that will look like, and they can use that to inform their decision.